Faced with scorching criticism from the Aged Care Royal Commission, Scott Morrison's admitting errors have been made in the system that's accounted for more than 2/3 of all pandemic deaths in Australia. He's also saying sorry to the hundreds of families grieving loved ones who've fallen victim to the virus. Tonight, there are still more than 1,100 active cases in aged care facilities across Australia. More than 200 people have died. Faced with such grim statistics and scorching criticism from the Royal Commission, Scott Morrison's admitting errors have been made in a system his government monitors and funds. National Affairs correspondent Greg Jennett reports.
The sad truth is, some days we fall short.
Failure finds words in a sorrow that now speaks.
On those days that we fall short, we're sorry.
4 days have passed since Scott Morrison last spoke here.
Thank you all very much.
A silence filled by the damnation of a silk.
Tragically, not all that could be done was done.
Peter Rosen's QC unloaded at the Aged Care Royal Commission on preparations poorly planned.
We will be submitting that it was not well prepared. The sector is not properly prepared now.
And the Commonwealth, as regulator and funder-in-chief of aged care, has been smarting ever since.
A pretty damning indictment. Would you agree?
I would take issue with those comments.
Do you have an apology to offer to those families?
We have at every occasion expressed incredible sorrow. We are certainly not arrogant or show hubris.
The sad toll on the frail aged is by now well documented. More than 220 deaths nationally. The virus has penetrated close to 100 Victorian facilities. Well over 1,000 residents, staff and carers COVID infected.
We are learning as we go. It doesn't mean we haven't got a plan. We do have plans.
The Commonwealth's defence is plans and funding were in place, but the Victorian system was simply overrun, swamped by the scale of community transmissions from outside the gates of aged care homes to within.
Of course we're sorry about that. Of course we're devastated by it.
Apologising for tragic failure was probably inevitable. Symbolism is important. Talk is also cheap. The deep malaise affecting aged care, sadly being tallied in lives lost at present, will also be counted in the billions of dollars needed to fix it by the time the Royal Commission reports next year. Greg Jennett, ABC News, Canberra.
COVID's curse is to find and exploit frailties where it can, and its effects aren't only felt by humans. Its spread has exposed weaknesses in governments and the systems they run. As political editor Andrew Probyn explains, there'll be many lessons to learn before this is all over.
Blame games are never pretty, but they've pretty much been the theme of the week, with coronavirus putting a strain on the Federation as well as the health system. No one wants to wholly own the disaster that's unfolding in Victorian aged care facilities, and the squabble between the Commonwealth and the state government over culpability is getting untidy. The aged care sector was troubled before the pandemic. Overlapping lines of responsibility haven't helped. Scott Morrison's becoming adept at contrition in this crisis, but there's a clear sense he wants Dan Andrews to shoulder more of the blame. Systemic failures spanning state and federal jurisdictions aren't restricted to aged care, of course. Today's damning Ruby Princess report cleared Border Force, with New South Wales Health harshly criticised. But questions remain over federal responsibilities, with airlines still furious they weren't given a passenger manifest by federal authorities to stop passengers boarding their planes. A once-in-a-century pandemic is testing a 119-year-old federation in ways no one could have imagined.